Hi, everybody. Can everyone hear me? It sounds really loud to me, but I don't know if all of you at the back can hear. I thought we might just get started while people are still trickling in a little bit. Thank you all for coming tonight to our first research seminar out of, how many are we doing? 7? 8? 6?
6, I think.
Yeah, 6. Yeah, right. So tonight, I thought we're going to have a little bit less content tonight than in the sessions that will follow, just so we can kind of get a lay of the land with what everyone in the room is interested in. We'll introduce ourselves and kind of outline the program for the next 6 weeks. So I'm Sarah Young, and I'm the research fellow for Clifford Craig, kind of in conjunction with UTAS. And I do a lot of work helping people at the hospital do research. I help out with medical students and also participate in research myself. So my role is very research focused. Kath, Ogden in the corner. Do you want to just introduce yourself?
Yeah, sure. So I am a senior lecturer at the clinical school, so the students know me well. And previously held the role that Sarah does now, but now a bit more focused on our students and our teaching program, but have done a lot of research over the years and really do enjoy doing research and talking to people about research. So very happy to be part of the program.
And then also Nick Shackel is over on that side. Yeah, Nick and Kath actually ran a similar series 2 years ago now. So the way that we're going to run the program is obviously every Monday evening, with the exception of a holiday Monday. We're hoping that we can give you guys we're going to sort of ask everyone where they're at in a minute, but the idea is that this isn't just didactic teaching. We like it to be interactive. Get an idea of why all of you are here, what you're hoping to get out of it, because that will help Kath and I tailor what we're teaching you guys. If there's something that you need more information about, we can talk about that and whatnot. So it's important that we get some feedback from you. And I know Sally sent an email out late last week just reminding everyone to come with ideas if you have any. And if you don't, that's okay too, because I imagine there's a real spread in the room of where people are at and what they're doing with research at the moment. So Kath and I are doing a fair few of the listed lectures. We're having a couple of guest speakers as well over the course of the program. So yeah, there should be lots of variety to keep you guys interested. So this is kind of what we're planning to do today. We're going to kind of poll you, and hopefully some of you will be willing to share with us where you're at in research. Some people probably have extensive experience here, and other people might be just starting out. You might be needing to do research for part of your training or as a student, or you may just be interested in research and bringing it to your department. So we'd love to hear where you guys are at in a moment. And then to accommodate for everyone, we're going to kind of start at the beginning, looking at how to formulate a research question. Where do you come up with a research idea? How do you take a clinical question that you might have from your practice and turn that into a research question? Because sometimes you might have an idea for something or a question that you can see needs to be answered based on what you're doing at work, but you might not know how to turn that idea into something that's actually manageable in scope and feasible to do and all those kinds of things. People often struggle with setting boundaries on research questions, and the tendency is to make them too big. So we can help give you some ideas and frameworks on how to do that effectively. And then we'll take a look at how you can use research design to answer your research question. Because depending on what you're asking, the way that you're going to answer it obviously is going to be different. So are you asking a question that requires a lot of depth to the answer, or are you asking a question that requires a lot of people to respond in order to get the information that you want? So we'll talk a little bit about all of those ideas just to help those of you that are starting out on your research journey. And then, yeah, we'll break up into 3 groups, and Kath and Nick and I will each work with one group and just talk to you guys specifically about what you're doing individually. And yeah, just get some ideas. We might be able to bring ideas back to the group in our next lecture next week. We'll just see where all of you are at. Is there anything you wanted to add?
Nope, that's great. Thanks.
Cool. So is there anyone willing to share either where they're at in research, what they've done, what they're hoping to get out of the course, why you're doing the course? Anything? Anybody?
Be brave.
Be brave. There's no wrong answers.
The bravest of you will get a bottle of coffee.
Yeah, that's right.
I'm Selena. I'm a general and perioptician, and at the moment I'm working on designing a project in pre-op frailty assessment in major GI surgery and how it might be predictive in post-op adverse outcomes.
Nice. And are you doing that for?
I'm probably going to turn into a PhD with the Anthony.
Yeah. Oh, with the Anthony. Okay.
Very
Yeah.
part-time PhD,
Yep.
but we're going to make multiple small projects along the way.
That sounds like a good plan.
Just doing it for interest's sake.
At this stage, yeah. Right. And so is the Anthony providing supervision to you? Yeah, okay. So this is a good thing to think about. If you're just starting out and you're interested in research, it's a great idea to find yourself a mentor of some sort within your department who can guide you a little bit along the way. We are here absolutely to help, but in terms of specific clinical knowledge, it's great to have someone in your department, in your field, that can provide you with that level of advice. So that's somewhere you can start as well. You can ask around, find out, there's usually someone interested in research within every department, if not more than one person. And you can also ask us because we're pretty tuned into who's doing what. And you may have there's different levels of expertise and just different ways of looking at questions. So talking to people about it is always a great idea. Anybody else have anything they'd like to tell us? Yeah.
Hey everybody, I'm Soraya. I'm a dietitian here at the hospital. I've been given a spot in the Festival of Ideas program, so that's a joint venture between UTAS and THS. And they partner us up with a mentor, and the idea is that it's a 1-year research program, hopefully with some publishable research at the end. My idea stemmed from when I was reviewing a patient and we've all seen it before, but lunch came, tray was way too full, out of reach of him, next to a urine bottle, and I spent 40 minutes, half an hour talking to him about what he was going to eat, education, getting the right food on the tray, and that was placed in front of him, and he looked at me and goes, I'm not going to touch that.
Yeah.
So over the next period, I want to investigate barriers to mealtime intake from with a focus on the patient perspective as well. So really trying to give them a bit of a push to what's important to them. Neonatal code blue or the Bravo. And then hopefully from there start to build some solutions, and if there is anything that we can, if it's sitting up in bed or somewhere to get some extra feeding assistance or the issues with the menu. Exploring around those areas.
That's awesome. I've heard of that program, but I've never actually spoken to anyone who's doing it. What stage are you at now? Like, has it started or?
Early stages.
Yeah.
So typically started about February. So,
yep.
I'm still in kind of reviewing the research. There's a lot in assisted meal times and protected meal times and what works.
Yep.
There's nothing really answering my question in a reasonable perspective. So there's a bit of work around it in tertiary metropolitan hospitals.
Yeah, right.
Of which we are not one. So
yep.
we can give a different perspective.
Oh, that's fantastic. Very cool. Anybody else? Come on, guys.
Come on.
So my name is Dan. I'm one of the interns. I've previously worked as a research assistant, so a little bit of research stuff.
Yep.
I'm in stroke at the moment.
Yep.
I'm looking at a project trying to do an interventional audit times CT and times thrombolysis.
Yeah, right.
And try and get a bit of an idea of our baseline times and whether we can do something to improve our times afterwards.
And have you started that project?
Still planning.
Still planning. And do you have someone that's helping you out in the department?
Yeah, so I've been talking to Ruby, who I think is one of the nurses in that area, as well as our registrar.
Yep, awesome. Cool, that's great. And you're just doing that out of interest, you said? Yep. Excellent. Anybody else? You don't have to have an idea, you could just tell us why you're here and what you're hoping to get out of the program too.
I'm planning a systematic review about, I'm a last year of psychiatry.
Yep.
Training, so I'm planning a systematic review at any factor that's has got efficacy in the outcome with the case management. I'm still finalizing my question.
Yep.
Because it's a very broad topic.
Right.
I'm still, because I started with a broad topic, now I have to narrow it down.
Yeah.
So I'm looking at like first episode psychosis.
Yep.
What is the factor that that is involved in the outcome, good outcome in the case management?
Okay.
So it's just in the initial process.
Yep, that's great.
Yeah, I was just going to say,
Yes.
we actually don't have a session on systematic review, but we probably should try and sneak it in there somehow, because I think it is important.
Well, it's a skill that you end up using in a lot of projects, even if it's not the end goal of your project.
So thanks for that.
Throw into the bias statistics.
We could.
Yeah, absolutely.
Yeah.
Great.
Yeah, no, that's great.
So that's the other thing, if you have specialised areas, we can find resources for you and send you ways to do that. I've done systematic reviews and they certainly require a very different approach. I think Kath's done it, we've done it as well.
Yeah, I've done quite a few.
So, we've all got experience.
Yeah.
So come and speak to us and we'll help you do it.
Yeah, thank you.
We're also going to, we're in the process of putting together a suite of web resources for you guys. So there'll be, all the lectures are being recorded, so those are going to be available through the Clifford Craig website. And then we're also going to have, obviously we'll get to this in the lectures too, but just in case you're wondering, there'll be resources for ethics and governance processes, information about systematic reviews, how to use library databases, all that kind of stuff. So that is part of coming to the course, is you'll get access to that website as well. Excuse me. Yeah, anybody else?
I'm British, I'm a nurse in the renal unit. I have actually started my PhD.
Oh!
So I'm just going through the ethics application at
Yep.
process at the moment. But I'm looking at decision making for the older person and how to prepare them for dialysis.
Oh, wow, great. Are you doing your PhD through UTAS or? Yeah, okay. Oh, that's awesome. And what year are you in? Or?
I've only just started a year in.
Yep.
Yeah, I'm doing it part-time, but I'd like to get it done within 5 years.
Yeah.
That's my goal.
Very achievable.
Thank you.
Oh, that's great. Well, we've got a real range already of what you guys are doing. And are there any med students in the group? Oh, there's a few.
They're all just sitting like this.
Yeah. Well, yeah, and so you guys will have, if you're interested in research, that's great. And we can talk about how you can get involved in existing projects. And we're also looking at ways we can involve medical students in research more broadly in the hospital. So it's great that you guys are here. It's great to have allied health here as well, like nurses. Yeah, it's a really nice mix. So, is there anyone else who wants to say anything before we move on? Okay. So, where to start if you don't have a research question, but you want to do some research? So I imagine there are people here in this boat, probably the medical students and others. In this field, obviously it's not the same in every field, but usually asking around in your department, there may be research that's ongoing. There may be stuff you can get involved with if you're really new and you just kind of want to dip your toes into research. If you want to start a project of your own, and you have an idea, that's also possible. Again, asking around your department who's interested in research, who's willing to help out beginning researchers, talking to us is another option. And also other clinicians can help you flesh out any ideas that you might have based on your own clinical practice and talk to you about things you might not have considered. So maybe you've been inspired through your own experience to do research to make an improvement, or maybe you want to get more information about a procedure in your department, so you might be interested in conducting an audit, which we'll talk more about in subsequent lectures, because you've probably heard that term being thrown around a lot in medical research. And it's often a place that people start with research, is doing an audit. Anything else you want to say here, Kath, of where you would start?
Yeah, no, I think the only other thing is that, you know, just thinking about what's happening around you in the clinical environment as well, and actually looking to, you know, there's nothing to stop very junior people coming up with the research question and pulling in the more senior people to help them answer that question as well. So just, you know, noticing things and being inquisitive and wondering, and I think, you know, with research, thinking about how we can do things better doesn't necessarily always relate to just treatment of disease, but actually how we provide services as well. So thinking about how we provide our medical services can often bring up lots of research questions also. So yeah, there's nothing to stop an intern or a medical student from having a really good idea and going to someone more senior to talk to them about it.
That's a really good point as well, that, you know, when you think of medical research, you often think of really, you know, you think of randomized controlled trials and research with a biomedical outcome, but there's also health services and implementation questions that can be asked. And often it's the clinicians that are able to see a need for those questions to be answered. So those types of research are also really important in this environment. And the way that those questions get answered is quite different than, you know, looking at strictly a biomedical outcome. And the populations of people that you interview are different. You know, it's still medical research if you're interviewing other health practitioners about their practice. So, you know, don't forget to look at things through that lens sometimes too, because those questions are also really important for changing practice and improving practice. Yeah. So I think what we were going to do next is actually look at an example question. So look at a scenario and how we might, there's a lot of words on this page, so don't get intimidated by that, but I kind of wanted it written out in case you wanted to access the slides later and it would jog your memory of what we talked about. So don't feel the need to read it all, because Kath's going to talk through it a little bit.
So I'll just talk through it. So this is an example from my practice, and it's purely meant as an example. You know, everyone is working in different areas in different contexts, but it's quite good to just illustrate how a simple thought can actually lead you in a whole lot of different research directions. So the question that we had where I work at Family Planning Tasmania is, we're very aware, or the observation we had, I should say, is that we're very aware that in Australia, compared to other countries, we have a very low rate of use of long-acting reversible contraception. So, you know, the initial question is why and what can we do about it? So thinking about how you might take that observation into a research question and then a research methodology, you can go in just in a large number of ways. So the first thing is, well, you know, what is the uptake of LARCs in Australia? Is our observation a true observation, or is, you know, actually are we doing better than we think we are, or what's the extent of the issue? So you might answer that question with a simple audit, just an audit of practice to see what rates of LARC uptake there is in your practice. But then you might think, well, that's our practice, but perhaps different contexts might be different. So comparing different contexts in terms of LARC uptake might be the next step. And then in different populations, you might have different rates of LARC uptake. So you might look within your data set at different populations to see if there's anything unusual or anything that's going to give you some clues as to how to move forward in trying to improve clinical practice. And then the next step might be to think about, well, why is there a low LARC uptake in Australia? So, and then you can think about, well, there might be different levels of service provision that might relate to why that is. So it could be patient-related issues, there could be practitioner-related issues, and there could be system-related issues. So, you know, if you're someone who wants to do a small research project, you could just hone in on what are the patient-related factors when it comes to contraceptive choices. And what are the barriers for patients to uptake of LARC? So, or you could take the avenue of looking at what are the system-related barriers or practitioner-related barriers or practitioner-related issues. So you can see there's also already quite a number of research projects here. And then the next question is, well, what can we do about it? And that's when we start to move into perhaps the more sort of familiar territory for medical researchers, which is thinking about, well, what's an intervention that might improve LARC uptake, and how would we test to see whether or not that intervention is effective in improving LARC uptake. And that's when you might move on to a randomised controlled trial, for example, or you might not choose that methodology. You might actually implement something and evaluate that program that you've implemented. So it doesn't necessarily, looking at an intervention doesn't necessarily require an RCT, and they're difficult to do, RCTs, and they require a lot of resources, and you know, everyone puts them up there in the top of the evidence pyramid. However, when we're talking about services and how we provide services, often the research methodologies are different and can relate to looking to doing a really thorough, effective evaluation of the implementation of a program. So I think I've kind of got there without actually following the slide at all. But you can just sort of see from that example that, you know, there's all sorts of different ways, and then we haven't talked to you then how you haven't even sort of got to how you then formulate your actual research question, but probably most of you know that. That's probably the starting point when you're at uni and you're taught about PICO and how to structure a research question. I think the hard thing for a lot of us is actually getting from that sort of observation to a defined area of research. And we'll talk to you in coming weeks about how to then decide what methodology is the most appropriate methodology for this particular research question.
We're going to cover that very kind of superficially in the next slide, but
good.
Yeah, so just picking up on what Kath said, thinking about LARC use, that's a massive topic. You could probably do a PhD on this topic, but you could also do a small audit, or you could do a small qualitative study. So, which is interviewing people, talking to people, getting in-depth information about a small slice of this problem. You could do an RCT and getting a lot of information about, you know, a more surface level element of the problem. So when you're thinking about LARC use, you're also thinking about, who do I want to talk to about this? Is it the women using the contraceptives? Is it the practitioners prescribing the contraceptive? Is it, you know, who is it? And then you need to think about the specific question you're asking, and that will lead you to think about how you're going to answer it. If you want to know what women's experiences are using LARCs, then you're not going to do a randomized controlled trial, because that's not going to answer your question. If you want to know how many women in Australia use LARCs and for how long, well, maybe you're going to do a survey. So like you can see that you can look at this problem or this situation from so many different angles, and the possibilities really are, there's a lot of possibilities of what you can ask and how you can answer it. And that a lot of that depends on what you think needs to be discovered, what's available already in the literature, and what you could add to that knowledge base. So there's lots of factors that come into play when you're deciding what to ask and how to answer it.
Yep.
And I think we just...
And I think, you know, to that point too, it's really important to go through that process rather than to jump to a methodology.
That's right.
I think that's what you're about to talk about.
I think, yeah, we say that specifically.
Yeah.
So starting with a problem or a question is kind of the right way to do research. Sometimes people come in with an idea of a method they want to use, but it's hard to retrofit a question to a method. And the logical process is to start with a question and then figure out how you're going to answer it. Often when people start with a methodology or a method and work backward, it ends up in really poor quality research. And often research that's not very usable. It's kind of like trying to do a puzzle backward doing that. It just doesn't, it tends to not work at all. So you think about your problem and your question first, and then that in combination with what information you want to find out, what is available in the literature already, what you can add to the knowledge base in your field, leads you to how you're going to answer the question. So that leads you to your method. So that's kind of the right way to go about research. Sometimes we have people come to us with questions and they've got this idea they really want to do an RCT, and you know, can we tell them what they should do it on? But it doesn't really, it's almost like those aren't, what's the right word, authentic or genuine. They don't evolve naturally when you work backward like that. So always try to start with the problem. It ends up with better research for sure. So there actually are labels, which we've been tossing around willy-nilly without explaining them, for the different types of research. RCTs, numbers-based research, is known as quantitative research. Most of you probably know this, but just in case you don't, I'm just going to say it explicitly. We're going to go into much more depth in subsequent seminar series, lectures about what quantitative methods are, what qualitative methods are, which are sort of more in-depth, rich methods of data collection, such as interviewing people, and also mixed methods, which is kind of the third and final broad category of research paradigms. And mixed methods are exactly what it sounds like. You're using a quantitative element and a qualitative element to answer the question. And once again, once you determine your question and what you need to discover in answering it, it guides you toward the correct method. And that's a process that if you're new to research can be intimidating, and you're just like, well, how am I supposed to know? But that's where using resources and talking to people who have more experience than you can make it a lot easier and smoother for you. So I think that probably, hopefully that, does anyone have any questions? Does that kind of illustrate on a superficial level what the basic process is if you're starting from nothing? Is that, anyone got questions? No?
Just make a quick point.
Yes.
That idea of the question. The other thing that often happens is we get people coming to us with, I have a data set of
Yes.
questions or something, and what question can I ask? And this is a very common pitfall in clinical research, and one that, you know, if you leave here today trying to think about it as a question, rather than I have access to this group of patients or this data, then you're going to do much better research. And we'll show you how focusing on what we've already said, the method or the data set, is completely the wrong way to think about it. It sounds more opportune, it sounds like you're going to get something realistic done. But really what we're doing is not asking a proper question. You're simply trying to find an answer out of a data set. And we see that all the time.
All the time.
Consulting people. So, you know, really important take-home message is focus on that question first, and then how to do it second, not the other way around.
That's a great point, and I knew I was missing something when I was saying that people start with a method. They often get handed a data set, and at the beginning when I said, if you're looking for ideas, ask around your department, sometimes that happens. They'll say, oh, well, we actually have this information from the last 10 years on X, Y, Z, and here you go, make something of that. But as Nick says, it's just going to be riddled with problems if you're trying to sort of backfit a question to a data set, because it doesn't evolve in the right way. Yeah, so that's something to avoid if you're asking around a department for ideas. Don't just accept somebody's random data set. You also, when someone gives you a data set like that, you have no way of knowing how it was collected and, you know, the integrity of it. There's lots of additional problems with that as well. So keep all of that in mind. Where are we at now? Right, I've kind of already said this. It's pretty much exactly what I just said. I'll leave the slide in there for you guys if you want to look at the slides later. But this is kind of where we're going to head now. It sounds like a fair few of you already have research ideas or frameworks that you're existing in, so we can talk about that in our groups. Even if you don't have an idea, the small group discussion can be really useful because just listening to how people think about it and what the process is can also help bring ideas to the fore of your mind as well.